Welcome back to the Ed Show. The House health care bill, I don't think it's good enough. I had Chairman George Miller and even progressive fighter Alan Grayson try to talk me into it last night on this program. I'm not there yet. But I think the weakened public option is designed to fail. That's one of the reasons why I don't like it. Negotiated rates could make the public option even more expensive in some states. Speaker Nancy Pelosi says this bill is just a first step. Well, if we fail on the first step, we'll never get a second one, and who knows what's going to happen in a year from now and in 2012. The Republicans will strip any reform we do right out of it, and we won't have anything, no matter what we pass, if they get back in the majority. Joining me now is Ohio Congressman and former presidential candidate Dennis Kucinich. Congressman, good to have you with us tonight.
Thank you, Ed.
I want to know why your amendment on single payer was stripped out and we're not going to get a vote on that in the House. What's happening?
Well, we're fighting to get it back in. I have the support of John Conyers, Lynn Woolsey, Neil Abercrombie, and other leaders who are saying put that back in, because that's the one hope that consumers have, that we'll be able to discipline the insurance companies, because as long as there's the threat of a state single-payer plan germinating, the insurance companies have to be careful about how they price their premiums in any given state, which is why we have to do everything we can to protect that state single-payer option.
Well, the other thing about that is it kind of tells me that they want that crowd to go be quiet and it's over with, you're not going to get it. I mean, to not allow a vote on it, to me, sends a message, you got to be quiet on this because we're moving forward and this is the way it is, which is exclusion, which we've seen from day one. Now, you've got 7 members that have signed on to this. John Conyers, he's a great guy to have on your side. How confident that you're going to get this back in and get a vote on it and the publicity to follow?
Well, we'll know by Monday, because we're trying to get it back in the manager's amendment. Remember, this passed in the Education and Labor Committee, and I think that we need the support of the American people to say, look, you need that state single-payer amendment in the bill to make it credible. I mean, what are people giving up already? They're being mandated to buy private insurance. If you read the bill, the people are going to end up paying, the insurance companies can raise rates 25% right off the bat, if you read the language of the bill. I'm looking at how people are penalized.
Say that again, Congressman, hold it right there. Say that one more time. I want our audience to really consume that tonight.
I have it right here, Ed. It's on page 22 of the bill, right here. It says that the rates shall be set at a level that does not exceed 125% of the prevailing standard rate for comparable coverage in the individual market. Now, it's very easy to understand that that means...
That's not reform.
It means it's a 25% increase they'll have the ability to execute. And since insurance companies have already raised rates for the last 4 years by double digits, we can expect, based on the bill, another rate increase by the insurance companies. This bill has a lot of problems, and I think that when you see that it gives the insurance company not just an ability to raise rates, but people are mandated to buy insurance. If only 11 million people may have access to the public plan, that means that everyone else is going to have to buy private insurance and be subjected to increases in premiums, co-pays, and deductibles. There might be a cap on the amount of money that goes out, but those co-pays, deductibles, and premiums are what are just killing the American people.
So this is a whole bunch of money going to the insurance industry that has been fighting reform all along. And this is really a sellout in the early years to the insurance industry. I don't care, and it doesn't cover enough people in the public option, in my opinion.
Maybe instead of a sellout, it's a bailout. Maybe what we're looking at here is another way that Wall Street's speculative engine can be fueled, this time with the help of the premiums of tens of millions of Americans.
How's the base going to respond to this, Congressman? Do you think core Democrats are going to revolt on this?
Well, I don't know if we could say they'll revolt, but people need to know that this bill has a lot of defects, and that one of the things that would make it possible to believe that we won something is if they put the Kucinich Amendment back in for state single payer, so that people would at least have the option of breaking free from the insurance companies if their rate-making practices and their co-pays and deductibles are confiscatory. I mean, we have to regain control here. Otherwise, what do we have? We have the insurance companies calling this show Ed, the insurance companies are the problem. They're not the solution. And to have a bill that puts them as the solution, I think, is a step in the wrong direction.
No doubt about it. Congressman, I'm with you on this 100%, and thanks for speaking up. I don't think the American people, once they read the 1,900 pages, are going to like this, and I think they're going to want more. Thanks, Dennis. Appreciate your time. For more, let me bring in Joe Madison, XM radio talk show host. Stephen A. Smith is with us tonight, journalist and commentator, and Michael Medved, radio talk show host and author of the book, The 10 Big Lies About America. Stephen A., what do you make of all of this?
I just think that the president, he's more concerned, it seems to be, he's more concerned with gaining Republican support than doing what he said he initially was going to do. And you're talking to somebody that is really, really suspicious of the public option in terms of you got to make sure it can be paid for. You and I were talking about that earlier today. You know that's what I'm all about. You got to make sure it can be paid for. But in terms of the president of the United States himself, you said you've got to step up. He's been as soft as cottonelle tissue on this issue. I mean, you've got the House, Democrats in the House, you got Democrats controlling the Senate, you're the president of the United States, but you seem so focused on getting one or two Republicans. I just don't understand it. It makes no sense, and I think this reeks of that.
Joe Madison, how do you think, from what you've heard in the last few days, how is this House bill going to be received by core Democrats and those who got into the process and expected big-time reform, and how are they going to take this bill, and will there be some pushback on it, in your opinion, from the base?
There has to be pushback on it, and it depends on how this news gets out. Now, like today, the vast majority of the people that I talk to on my show, Ed, support the position that you and I and others have taken, this allowing states to opt out. I even had conservatives call my show and say, well, I hope they do go to allow states to opt out, then we can get rid of some of those deadbeats. I mean, the reality is that you've got a Senate bill that now allows quote-unquote blue dog Democrats to go back to their state and give the people something that can help them get reelected. I don't know. I tell you this trigger thing we're talking about, whoever pulls it may shoot themselves in the head.
No doubt about that, especially in the foot first. But Michael Medved, is President Obama showing weakness here? Is he handling this wrong, or is it all about timing and he's going to come out strong? What's his call? What do you think is going to happen?
Well, I'm going to, for once, defend President Obama. I think he is being cautious, and it's appropriate. The main group of the American people, the huge majority, are more concerned about the state of the economy. The market went down 250 points today. We have a troubled economy. We don't have a recovery. And the American people want the president to keep his eye on the prize, and that is economic recovery. I happen to believe that all of the uncertainty and all of the fears and all of the back and forth over health care has actually harmed the chances of recovery. And I think the president is right to be extraordinarily cautious before you have a $1 trillion new authorization for spending that is not paid for and can't realistically be paid for without pushing us deeper and deeper into debt.
The House bill is paid for. The House bill is paid for. You know, fees and taxes are going to go up, and which I've told you all along. In fact, all of the bills have got mechanisms to get paid for right now. But what I'm not getting is that the president is not being crystal clear on what kind of public option he wants.
Well, I think you're entirely right. But also this question about it being paid for is not entirely clear. Because I don't think that these numbers add up at all. And it's going to be very tough to sell people on a $300 billion cut in Medicare when people are living longer and Medicare expenses are going to go up.
It's one thing to be cautious, like he said, but it's another thing to come across as not providing any kind of leadership whatsoever. More than 69 million Americans voted for this man. This man was talking about universal health care. This man was saying that he had a plan laid out, yet and still he puts it to the House and he says, come up with a plan for me. He's looking at Harry Reid and Nancy Pelosi. Everybody is looking for Barack Obama. Guess what? 69 million people did not vote for Nancy Pelosi. They did not vote for Harry Reid. They voted for Barack Obama. And again, whether I agree or disagree, and we both know I got my questions, the reality is that you have to come forward and you have to be the one that puts the plan in place and not somebody else doing it for you.
Joe Madison, I got to ask you, Joe Madison, what's going to move the president at this point?
Well, I think him not listening to the advisors he has in the White House and doing what Stephen has said Barack Obama has a high popular vote. I think he's getting some very bad advice, and what I heard from Dennis earlier today reminds me of something I think Will Rogers says. We've got the best Congress money can buy.
All right, gentlemen, thanks for joining us tonight. Appreciate your time on this issue.